Hi, I'm Dr. Sara Hurvitz from the University of California, Los Angeles. In 2007, which was just at the start of my career as faculty treating breast cancer, I encountered a patient who had been treated earlier, several years prior, for an early stage ER-positive breast cancer. She had received chemotherapy and surgery and radiation. And when she came back to see me, she had just recently been diagnosed with metastatic breast cancer in her bones. And she had a biopsy that confirmed this was the same ER positive breast cancer that she had years prior, that had never been completely cured, even though she'd gone through aggressive therapy. That breast cancer had survived and was able to grow up and create a painful tumor in her bones. She enrolled in a clinical trial that we had just opened, evaluating a drug called palbociclib, now known as Ibrance, in combination with an anti-estrogen therapy known as letrozole, an aromatase inhibitor. And this was an early phase clinical trial, but she believed in participating in clinical trials. She believed that that's the way the discoveries occur in cancer research. And she volunteered to go on this study and started therapy in 2007. She remains on therapy today in 2021. She has not had her disease progress or get worse on this therapy. In fact, we can barely see any evidence that she had metastatic disease in her bones on the scans that we're doing. She is the longest survivor on Ibrance or palbociclib in the world because she was enrolled in that phase 1 clinical trial of it for metastatic breast cancer. And she's become a vocal advocate supporting enrollment and participation in clinical trials. Her therapy response is not 100% typical of what other patients experience, but her participation in this study did ultimately lead to the clinical trials that led to the FDA approval of this drug for metastatic breast cancer. This drug's now been shown to roughly double the length of time that women can live with their disease under control. So it's really pushed the curve or the envelope in the management of this type of disease. And cyclin-dependent kinase 4/6 inhibitors or CDK4/6 inhibitors as a class have now demonstrated that they're helping women live longer. So her story is my favorite one of an exceptional responder because not only did she benefit from it, but her willingness to participate in research helped other women benefit greatly from this drug.